Welcome back to the PFC podcast. The views and opinions you are about to hear are the speakers and do not necessarily reflect those of anyone else. Now on to the podcast.
Welcome back to the PFC podcast. This is Dennis, and today I'm with Justin. How are you doing today?
I'm doing good, man. Thanks for having me.
Oh, the pleasure is definitely mine. You're the originator of the Prolonged Field Care podcast, so it's kind of cool to be on the other end.
Man, and you're doing so much more and a way better job than I ever did. So, dude, it is awesome. It's very cool to see what you're doing with it.
Hey, I appreciate it. Other than, just fanboying around, the actual reason why I wanted you to come on is your career in the psychology realm, and I wanted to talk to you about combat stress and dealing with combat stress and others and yourself, and such as that.
All right, yeah, man, I'm very excited to talk about it. I've been thinking a lot about it when you reached out. Like, oh man, what could I say that might be helpful? Yeah. So,
would you mind just real quick? Would you mind just doing a real quick introduction of yourself?
Sure. Yeah. So my name is Justin Ball. I am currently a licensed clinical social worker, which is still awkward for me to say, because I'm a dude and a former Green Beret and all that stuff. But I started out in the Army as an 11 Bravo. I was at 3rd Ranger Battalion, in a rifle squad, 203 gunner, saw gunner, all that stuff. And man, I got Hey-You'd to like squad EMT. That was like, I think it was like 1997 or 98, something like that. And like my buddy had to go to bus driver school, and I got pointed at, and they're like, EMT. And man, I went to, I think it was Fayetteville Tech Community College, did an EMT thing. And there was an old crusty Vietnam vet paramedic there who was a 18 Delta. And dude, I just loved the EMT course. And I'm like, man, I'm done being 11 Bravo. This is cool. So from that point on, I went to SFAS and did the whole medic thing, and really enjoyed that as part of my career. So I was at First Special Forces Group for a bit. Then I did most of my career at the Special Mission Unit at Bragg as a direct support medic, and then a kind of a key leader in the medic realm. So I've had a very medical SF career, and it's a very different perspective, when you're pretty much only a medic in that setting. And I got to be honest, man, I missed being on ODA. That was my little 12-person family, and I've never had anything like that. It's very cool. But yeah, so I'm doing private practice mental health work here in Pinehurst. So I got a little office here, my own business, and I'm learning all the woes and what I don't know about how to manage money with a business, and it's quite an education, man. New set of stressors, but I really dig it, man. I'm working with. I thought I would do primarily trauma work, combat trauma type work, but that's not what comes through the door. And what comes through the door is a ton of relationship, marriage, family stuff, parent-child stuff, and retiree problems, disgruntled sons of SF guys problems, and it's like, man, I got to see this whole other side of the world where dad's gone a lot and what the effects are on the family. So it's been a very eye-opening for me, because you think because you were there, and then you get to see the other side where, man, families, there's a lot of families really hurting out there from just the lifestyle. It's really hurting a lot of folks. But yeah, that's where I'm at today. Yeah.
Nice. So just kicking things off, I was hopefully looking on the combat side of things, but when you're downrange, like everybody's got an edge. Everybody's got an edge to them, and I think in some ways that's helpful. However, sometimes people go a little bit too far, and potentially they can become dangerous to themselves, they can become dangerous to the team, or just the mission as a whole.
Yeah.
As a medic, and I'm from an ODA's perspective, like, you are there every day, just smelling each other. So you get to be on the ground floor to whatever disaster this is going to turn into. Like, how do you recognize that this has become like maladaptive, like this is not helpful, versus somebody's just having a bad day?
Yeah, so I think there's a few angles to take with that. Like one is just recognition of what's going on. Another one is the expectations we set for ourselves. That's a big portion of this. So I want to talk about I want to be vulnerable. I tell people to be vulnerable all day in the therapy office, but I'll be vulnerable with you. I'll tell you about a time I got really stressed out and I lost it as a medic. And it was with my own kiddo, So like, I had been out. I mean, I had a mid-career break in service where I did a civilian job for a bit. But man, I just came out of, multiple deployments. Man, I'd been through pediatric advanced life support. How many times have you been through that, man? And PEP and PALS, and, so arguably the best person to take care of my kid. And man, I've been in some pretty intense combat situations and treated people, and I think I know myself. Well, my driving down the road, my son was 2, and I look in the rearview mirror, and it looks like he's choking, and he had something in his mouth, and he of course he's a 2-year-old, got something in his mouth, and I pull over to the side of the road, and it's just like they talk about, man, tunnel vision. And it was like, I can remember speaking slowly. And I remember like my wife looking at me saying, "Do you want me to call 911?" And I'm like, "Yes, call 911." And I get my son out of his seat. And because it's my kiddo, man, it's my son. I lost my damn mind. And I just stood there frozen. And there was very little activity happening in my brain. And I remember the only thing that came out was super unhelpful. This one cognition came out, and it was, "He doesn't look good," and so I just, like, my brain was not working properly, and I'm like, he must have been choking, and I couldn't remember, back blows and chest thrusts. Like, good Lord, you have a choking child. What do you do? Back blows, chest thrust. Like, do that, And I went to the back of the car, opened the tailgate, and I had him underneath there, and I laid him down in the back, and I was just kind of staring at him. And remember when, like, a new student, they do that thing where they like pat the casualty with their hands, and they're like, "You're not doing anything. You're just patting him." Like, what do you like? And it's really, it's like, I don't know what to do with my hands. But man, now I understand that as my brain went completely limbic. I was in a state of emotional hijack. My level of fear for my son was more than I could handle. And so he actually like went limp in my arms. And I remember it was like over. I was like, "Oh my God, this is it." He choked. I remember looking in his mouth, and I didn't see anything. I was just kind of frozen. And the paramedics show up, and this calm, cool, collected paramedic walks over speedily. He didn't like slow roll it like they usually do. He came right over, and he's like, "Hey man." And I looked at him. I'm like, "Dude, I think my son is choking, and I think he just died." And he's like, "All right, man, let's get in the back of the truck. Let's go." And he just pulled me right in the back with him. So I instantly trusted this guy. Now I realize he was co-regulating me. He was calm, cool, and collected. It brought me down a notch. And he's like, "Hey, can I take your son?" And like, "Sure." And he grabbed him, and we hook him up, and he starts moving. And I'm just sitting there watching it. And as my brain reconnected, like my lower brain and my upper brain started talking again, everything became clear. And I'm like, "Oh man, this is not what I thought it was at all." And and he's like, hey man, nothing in your son's mouth. He's breathing. We've got a good pulse here. He's unconscious. So I don't know, maybe he had a seizure or something, but we're going to head right to the ER. So we did. And, ER doc comes in, and my son's coherent at that point. And he's like, hey, congratulations, man. Your kid's got a fever. Like, you got a febrile seizure. These things happen. It's not an unexplained seizure. It's very explainable. And like, how many times do you get told, about febrile seizures and all these things? And so like my story here is proof that it's some things are too much, and in combat, I worked on Americans and I worked on a lot of partner force folks, but I never had to work on one of my dear friends, and so one of my messages, as we've talked about, medics dealing with stuff in previous conversations. So one of my messages is like, hey man, we got limits. Sometimes this is too much for your nervous system to handle, and no amount of training is going to stress inoculate you from that, and as medics, we heard it 100 times about treating family members and all that stuff. And that was literally the case. I was absolutely the wrong person to be taking care of my son in that situation, because I couldn't think straight, so it does kind of bring up the scenario of experiencing a limbic hijack in yourself, and I'm going to answer your question, Dennis. I'm kind of going in a roundabout way. As I was digging into my schooling, I just set out like, I'm going to get good with the neuroscience stuff. And man, I was getting so frustrated because it's complex, man. It's complicated. You got brain parts and brain regions, and this does this and this center and whatever. And I came across two people that were very helpful with this. One of them is a neuroscience fella, Dan Siegel, and Dan Siegel's work is it's the best. I use it every day in the clinic here. So he's I believe he's an MD psychiatrist he's probably one of those guys with a neuroscience degree on top of it too, and whatever. But his mission was to make this stuff digestible and usable for us. And as I got into his work, as opposed to textbooks and whatnot, I was like, oh man, super helpful. So he's even the way he talks about the brain, a lot of it's being taught in schools now with little kids about recognizing when you're emotionally hijacked. And I was like, damn, dude, I could have used that. Oh my God, I could have used that 20 years ago. And I was even in lectures that sort of hit on that stuff, but I didn't get it. And it wasn't usable. And it's sort of like you can go through a bunch of CLS classes for Combat Lifesaver over the years, and then you get this one really solid March class, and you go, oh, got it. This is made for when I'm stressed out. And I got this word that's been driven into me over and over again, like by all these different teachers, March, and I'm not going to get screwed up. But if I try to do an ATLS trauma assessment on a friend under pressure with like, oh, I've now completed part 1, now I'm moving into part 2, like it's probably not going to happen, So like we better have a system that works really well. So anyway, back to brain stuff. The triune brain, right, is like this game changer for me. And this goes back, I think, to the 50s to a guy named McLean. And he was like just looking at the evolutionary structure of the brain. And it appears that the lower part of the brain, the reptile brain, which includes kind of the brain stem and automatic function, it appears that another brain grew on top of that. And that appears to be the seat of threat detection, the amygdala, and kind of a lot of emotional systems there. And then a third brain appears to have grown on top of that, which we call the neocortex, or the new cortex. And it's like, it's the newest addition to the team. And it's fascinating how they kind of all work in concert. But if you, I have this brain model, so if you're listening, you can't see this, but so this is just kind of like a whatever plane that is sliced in half. So the brain and they're like, oh, you got this region, this one, this one, this one. It gets kind of confusing. But if you take, this is all neocortex up here, and down low, you've got like the neocortex grew on top of this part, right? But this part right here is like hippocampus, thalamus, amygdala on the front, and it's a region. And it's why we call it, it's like a limbic system versus a structure, you know? And this is very similar to what animals have, like your dog, and their job is threat detection for the most part, you know, and it's older and more powerful than the neocortex. So when we talk about limbic hijack or getting emotionally hijacked, it's like this brain is completely taken over, you know, as it should in a life or death situation, because it keeps you alive, you know. And if we're using the wrong part of our brain, we're going to get killed. It's going to take too long and whatever. Underneath that, you've got kind of your reptile brain. And important to note that it's just not your brain here, but it's your entire nervous system is below that. You know, you've got, you know, the reptile brain, but it's your spinal cord and this huge web of sensors coming out. So it's not like, oh, it's the reptile brain. It's all the information, gigs and gigs and gigs of information every second coming in and up your spinal cord, going through this thing, through the emotional system, into the thought system, you know. And it's like, dang, there's a lot going on there. It can be too much sometimes for that thing to handle stuff, you know? So I guess one of my takeaway points here is understanding that this system is set up with limits, you know, and that's when we get into, you know, fight, flight, freeze, and faint as one of the explanations for how the brain reacts to things, you know. I had a freeze response with my son. Like I was in complete limbic hijack, and it wasn't time to fight. It wasn't time to run. And I did move around a lot with him. I probably looked like, if you could see a video of that, I probably looked like a crazy person running in circles with him. So my brain was, you know, like, oh my God, what do I do? My baby, you know, that's sort of like what it looked like probably. And I just kind of froze, you know, and we see that in animals. They can't fight, they can't run, so they play dead, or they fake they're dead. Something like that's happening. And I would invite your listeners to dive into Robert Sapolsky at Stanford. Man, that guy's the guru on this whole nervous system and how it's all working together and whatever, if they want to go down that rabbit hole. Anyway, one example of this, right? All right, so let me like throw a skill in here. If my brain is completely connected, I'm calm, my neocortex and my limbic system are talking to each other. They're still communicating. I'm not hijacked, but I encounter someone that is, I can do something about that, you know? What doesn't work is screaming at them, you know? And if you think about a lot of our CQB training where dudes are stressed out, I mean, they're not afraid of, they're afraid of losing their job. They're afraid of having to PCS somewhere new because they didn't make it. I mean, it is extremely stressful, you know, and it is not the time to reason with somebody, you know, so they're scared. And how many times does an instructor, you know, have the logical conversation with this guy they talk about it, man, eyes look like saucers and they're completely freaked out. It's not working, man. That brain it's not functioning, you know, and a lot of outside observers have noticed this about some of our training and said, like, I don't think that's a good learning environment. It's like, nah, it's the way we've always done it. If they screw up, you whip an air horn at their helmet, you know, and scream at them, and then hope they clear their sector next time or something like that. It's like, well, good luck, you know. So the skill here is co-regulating, and it's just that if your brain's intact and mine's not, but, you know, understand that you have that ability to help somebody out, just like that paramedic did for me. And then he's probably seen on a daily basis that paramedic was like, this person's completely out of their mind. I have to talk very calm and concise and confident with them and give them clear instructions on what to do. And it's not like they're screwed. They're going to come back. And I did come back, but because he was kind of regulating me. Who was not co-regulating me was my wife. She's freaking out too, so like it didn't work, but I needed this other presence to come in and like get my brain to reconnect, I had some interactions with some Israeli behavioral health folks, and they actually have this whole system that it's like a march type system they train their folks on. They're senior leaders who are usually very young senior leaders dealing with like even younger soldiers. It's very young military, and one of their problems has been people getting emotionally overwhelmed. And it's like, man, we give you all this good training and you're kind of freezing on me or whatever. So they had this whole system that they came up with of like training leaders how to deal with people who are freezing. But I think we have a different army, and I think we have different training and a whole different model. So maybe that hasn't been that appropriate for us,
Yeah. Well, I mean, our whole system is generally voluntary. Versus the Israeli that like you're going, that's your option.
And professional soldiers, who went through this very intensive training. Not that their training's not intense, but you'll do your few years and be done. And for ours, it's like, I've been in this kind of stressful environment for a really long time, and there's like team leader stress and squad leader stress and platoon sergeant stress, and all that stuff is kind of stress inoculating you over time, and then the training and everything. So, maybe it was, maybe listeners out there are like, oh no, man, that totally happened to us out there on whatever target that happened. But, I never really encountered it in a combat situation, and, I didn't do a ton of partner force stuff. So maybe guys kind of encountered that before and they're like, yeah, I had to do exactly that. I had to co-regulate these other people. And, so co-regulation is the skill. Now, I want to give you an acronym. All right. We love acronyms. All right. So this acronym comes from one of my teachers and mentors. Her name is Lisa Ledoux. And as far as badass females go, Lisa's a badass. She's like, I don't know, I think she's like 5'6", volunteer firefighter, paramedic, works up in Colorado, lives on the side of a mountain, does disaster work. So I met her through Team Rubicon doing the whole disaster thing. And so she's been a clinical social worker a really long time. And her problem that she had to get through was like people having a panic attack in your office. And I can vouch for this. It's really unnerving when somebody starts hyperventilating and all that's happening is they're having something going on in their head and they're re-experiencing or whatever. And you're like, oh, especially if you're like, oh God, what did I say? Did I cause this? But man, it'll get your heart rate up and you're like, hey, are you okay? Like maybe we need to take a break. And they're spiraling down and you can see like their eyes are getting big, starting to hyperventilate. And you're like, oh crap. So how would you calm somebody down? So Lisa got her acronym going and she's like, what I have them do is I have them slow down. And I just speak to them in a very calm voice. And as a medic, Lisa gets it. It can't be some complicated thing, right? And it has to fit into kind of natural behavior, sort of like March, like naturally we should stop the bleeding first, let's go over that. So first things first, we should probably slow down. And that can take a number of forms. If somebody's kind of emotionally hijacked, you're like, hey man, let's just slow down for a second. And I think of times on the radio during a engagement when you hear guys' voices getting higher on the radio, it's getting dialed up and a calm voice gets on the radio. And I remember one in particular said, slow down, everybody stop and take a deep breath. And man, over the radio, that co-regulated a lot of folks. So we were like, oh man, I'm speaking with a high voice. I'm breathing fast. I'm talking fast. I got to slow down a little bit. And just that cueing right there can be really powerful. It's a very simple suggestion to somebody. Hey, slow down. That could be having somebody sit down. That could just be like grabbing hold of them and being like, hey, let's just slow down for a minute. Could take a number of forms, but it's a very easy thing to do as a person intervening. It's like, let's just slow this thing down however you can. In the middle of a gunfight, I don't know, maybe there's something you can do there where you're like, hey, like maybe, I don't know, maybe you're behind cover or something and you're like, hey, we got to slow down, man. That brings us to the next letter. So S, next letter is A, and that's anchor, which is not the same as grounding. In anchoring, the reason Lisa chose anchor is because when humans are getting, like if you're getting washed down river, you are seeking something to anchor onto. If you're getting blown away by a hurricane, you are seeking something to anchor to. And when you're dizzy and you're falling, you seek something to anchor to, versus grounding, which sounds like a yoga thing. We're going to do some grounding right now. And she wanted to keep it very real. Like, hey, and her cueing for this is feel your feet. Right. And she's just like, hey, I want you to feel your feet on the ground. I want you to feel your socks on your feet in your shoes, and your feet on the floor. A couple of things going on here. One is you're putting your attention far away from your head. You might be in a thought spiral, emotional spiral, but I'm going to put my attention and feel grounded. And it could be somebody sitting in a chair having a panic attack, and you're like, hey, I want you just to feel your feet on the ground, your back on the chair, your butt in the seat, your arms in the armrest. I just want you to feel that. And what you're doing, back to our brain model, is you're taking them down to the reptile brain. And information is going up, it's going in and up instead of down and in. So we're kind of bypassing whatever's happening up here with the cortex and the limbic system, and we're just trying to get information to go up, because it's really hard to think thoughts and sense sensation at the same time. So it's like, hey, we're just going to feel our feet right now. Sometimes magical, just this, right? So the next list, so we got S, A, B, and the B is breathe. And this isn't a breathing technique, and it's not like, hey, we're going to box breathe, because a lot of those breathing techniques are very cognitive. They're very thought oriented. All right, how do we do it? Let's see. We're gonna like breathe, inhale for 5. We're gonna hold it for 5. We're gonna exhale for 5, and there, and you can get into a pretty negative spiral when you're like, this isn't working. I'm doing the thing they said to do, and the thing isn't working, and you can kind of spiral down from there. So it's just breathing, and what we're doing is just noticing that we're breathing. Okay, so I just want you to breathe with me, right? In and out. Just breathing naturally. So the next letter is R, which is repeat. All right, and we're going to go right back to slow down, anchor, breathe, repeat. And we're just going to keep doing this sequence over and over again until you can start to see the person kind of regain connection between their lower and upper brain, right? Then the last letter, so the acronym is SABRE, and it's SABRE. So it, whatever, maybe, I don't know, maybe that's like the English spelling or something. But the E is engage. And that's your cue as sort of a responder to now you can do what needs to be done. Now you can, like, I don't know, now I'd like you to shoot back, or like, hey, now I'm going to move you to somewhere else, or now we can have a conversation, or now you can engage them with a question, and I can think of a recent car accident where somebody was hijacked, and it was, and like they needed to get their license out of their purse. And I'm like, that's not happening. The person was shaking, freaking out in the car, and it worked fast. It was, hey, let's just slow down. Everything's done. The accident's done. Everybody's safe. Are you hearing me? Why don't you look at me? Yep. Okay. I want you to just feel yourself in the seat. All right. Let's just breathe. Okay. And then it went through that a couple of times, like, hey, the sheriff's deputy needs your license. Can you get that out of your purse? And then boom, they're actually executing a semi-complex task, and it's like, man, I could have used that a long time ago, Dennis. So I'm like, thank God for Lisa. And Lisa has taught this in all these different settings. She did a whole program with I think it was Aurora Fire Rescue in Colorado, just handling behavioral health emergencies. You got kind of like maybe you got somebody who's having we'll call it a schizophrenic incident, and they're really hard to deal with. And even in that setting, when they're, very, very unconscious of what's happening, this is very helpful to help them deal with stuff and de-escalate things, And if you take a really angry person, so it doesn't have to be emotionally hijacked by fear, you can use this with somebody who's really, really angry, really, really sad, really, really scared, So super useful. And again, I'm like, thank you, Lisa Ledoux. Where the hell was that 20 years ago,
Right. And I mean, that makes sense. Like, you see somebody and they're like in vapor lock, and you can just see their gears are just, things are spinning, nothing's catching. Their pupils are dilated, they're breathing fast, they're just not moving in a helpful way. But it makes sense. Like, okay, this is how I can at least begin to let them get some kind of traction, so that they can be a productive member of this dumpster fire that's happening around us. But that makes sense during that really stressful situation, right?
Do you remember? You remember in Band of Brothers? You remember the character Private Blythe, who's like scared guy, and he just freezes. He like won't even move, and he's sort of the quote unquote coward character. And you look at that scene and you're like, well, he's completely hijacked. I'm sure he'd love to shoot some Germans, but he's completely he's overwhelmed. And who knows what he's been through in his life, why his nervous system is so sensitive. Maybe it just is sensitive, but like, well, apparently today in Bastogne or wherever they are, it's too much. And I know that the producers were not trying to show a neuroscience lesson, but it seemed like when I think it was Captain Steele, like looks him in the eyeballs and he says something like, "You're already dead, man." He kind of co-regulated him, and I like it because it kind of shows him like very shaky, picking up his M1 and start taking some crappy shots, then he starts shooting some more. But it's like, it's something pulled him out of that emotional hijack, as opposed to the convenient excuse that, oh, you're just a coward. It's like, no, man, this is a nervous system right there. It's overwhelmed. I think taking incoming from the Germans might be a little overwhelming.
Yeah, probably, mass attack into France could be stressful,
Little bit. Thank God we had that 34-foot tower to get us all stress inoculated and jumping out of things. Yeah.
Yeah. Luckily, I had those 4 practice jumps beforehand. So.
Yeah. Don't get me going on that, man. I cannot imagine 2 divisions in the air at the same time. I can't.
Yeah. But now, outside of like the immediate. Okay, we are in a dangerous spot. I need you to lock back in so we all can get out of this.
Yeah.
Those times in between, when, everybody kind of disperses, like we've done the ARs, we've done the meetings, etc., and everybody kind of disperses, and everybody gets to think about what just took place, right? Yeah. Some people handle it better than others. Some people, they cope, they talk to each other, some they go to the gym, they go do stuff, whatever it is. How can I find that guy? Like, he could be the stellar performer always, but something's different now. He's just not, I don't know if coping is the right word, but he's not processing this well, and he's like getting angrier, and I'm starting to think like, hey, maybe this is not going great for him. Something is wrong. As a medic, they did not give me psychological training about what to do, If he was bleeding, I would know exactly what to do, but he's not. He's, going through some kind of emotional thing. How do I anchor that guy? Like, does SABRE work for that?
Well, man, that's such a good question, right? And I as you're asking that, I'm thinking of all these like behavioral health classes that I had over the years. We were like, hey, we need like psych first aid kind of thing, and I can't remember anything that they said. Yeah. Anyway, yes. So one of the sort of infuriating things that I learned in this new job, where you're like, damn it, man, I needed that a long time ago. So I get this phrase from Jim Lynch, that the doc I was telling you about earlier that I used to work for and does stellate ganglion blocks now. But he said to me, hey, depression and anxiety are two sides of the same coin, right? And it really hadn't occurred to me, that, hey, what we're talking about with depression and anxiety are just two sort of syndromes around nervous system dysregulation. So, I don't know if you ever looked at a depression assessment before, but if you've ever done some Army in processing thing, you probably had to fill out a PHQ-9 and a GAD-7, and you probably filled them out a lot, And I'm not telling your listeners to memorize the depression and the anxiety assessment, but they give you some clues here of like what somebody who is not doing well looks like. And at the bottom of the depression assessment, like question number 9 is, do you have thoughts you'd be better off dead or hurting yourself in some way? But that's question number 9. There's 8 things before that and 7 anxiety questions that are really helpful to cue you in and be like, oh, hey, maybe something's not going well here. And then when you really consider them, they make complete sense. So as I read some of these things off, I want your listeners to think of our coping systems that we have, like what we do in our community. And it's like, we really value sleep, like to get a good night's sleep. A lot of times on deployment, guys will sit around and play video games together. That's what they do. We like to eat, and we like to eat together. And guys are usually chow hounds, and we like to work out. And like that's how we cope. It's like what we do. And so as I read these things off, I want to invite the listener to think about, a lot of these things don't correlate to how we usually cope. So if you see somebody taking little interest or pleasure in things, like, there's one there. Question 2 is, do you feel down, depressed, or hopeless? Well, that's not, and it doesn't say sad. So I would say, is this person not their self, not their same usual self? And those 2 questions right there are your 2 depression screeners. Lost interest in things I used to like to do that help me cope with stress, and I'm just not myself. I'm down, But very rarely, like, I don't know if I ever met somebody who was really in the throes of depression that was sad. It was like, oh, I'm just so sad. They're usually like, man, they're this stressed. They're like, I am down. I don't know what is wrong with me, And so that's important to tease out there. Is like, man, don't be looking for sadness, and you're not going to find it in our folks. We're going to cover that up if we are, probably. All right, next one: trouble falling asleep, staying asleep, or sleeping too much. Like, becomes very apparent in living in close quarters with people if somebody's struggling with their sleep, And I would say that's sort of an easy one that we're all very aware of, and we'd like to talk about. How are you sleeping, man? If it's like, dude, I don't know what is going on, but I cannot fall asleep. Okay, to me, if I hear that with somebody, light goes off on the dashboard, it's like, uh-oh, that's not good. And just to pause on this for a second, like, you've got your sympathetic nervous system and you got your parasympathetic, and we're supposed to live parasympathetic, like, I don't know what, 99% of the time. And in emergencies, we live sympathetic. Well, that's not how it is now. We live in this sympathetic nervous system world. Everything, email, whatever, promotions, all these things kind of fire up your sympathetic system. as opposed to, I don't know, saber-tooth tigers or whatever. If you're sympathetically activated, probably aren't going to sleep real well. And if you can, and I don't, it's sort of like a marker of health in our community is like, you can go out, do something stressful and come back and get parasympathetic and get calm and ramp down. And when guys are having problems, it's when, and this is in my own personal experience of me, not doing well. It's like, man, I cannot calm down. And so I'm going to go back to my sheet here. So you got, little interest or pleasure, just feeling not myself, trouble sleeping, feeling tired or having little energy. Most of our folks are Energizer bunnies, and it's like, man, guys experiencing fatigue out of the norm, poor appetite or overeating. And when you're sympathetic, it's not time to eat. It's fight or flight, freeze or faint time. It's not time to sit down and enjoy a meal. You got to be parasympathetic to have an appetite. So we're kind of watching for these signs that they're not able to get out of sympathetic and calm down. Then you've got feeling bad about yourself, like you're a failure, things like that. Trouble concentrating, moving or speaking so slowly, or the opposite, which is being super fidgety and restless. So I think your commando who's getting stressed out in a deployment isn't sleeping, isn't eating, and is super restless and fidgety. And that doesn't mean he's got clinical depression. That means his nervous system is out of whack. And, high severity in these things would indicate, likely clinical depression or something like that. But that's a longer conversation to tease out. But for certain, there's no one who's depressed whose nervous system isn't all out of whack, So flipping the page over here, anxiety, right? Feeling nervous, anxious, or on edge. Yeah, we're going to do that inherent in what we do. And if I come back and I'm like, man, I cannot shake this anxiety, or I have this irrational, weird anxiety that just won't go away, warning lights on the dashboard should go off a little bit. Not being able to stop or control your worrying too much about different things, trouble relaxing, being so restless it's hard to sit still, becoming easily annoyed or irritable. That's going to be tricky, right? Feeling afraid as if something awful might happen. So we're really going back to this limbic brain where your fear circuitry is sitting. A lot of your fear circuitry is in there, and it's overactivated, and it's like, man, so if I, as a team sergeant or whatever, you recognize your folks, because team sergeants certainly never get limbic hijacked or stressed, right?
They got the easiest job in the world.
It gets better with age,
Yeah.
So like having these, I would say, to sum it up, go back to sleep, exercise, nutrition. As like, this is what our guys do. That's normal, how they cope. If guys aren't doing those things, or you think they might be struggling, if guys having a hard time getting an appetite to eat, and he's just not working out like used to or something. It's like, hey man, are you good? Are you okay? And then the other aspect of this is, this is very neurological, but very psychological, is the shame factor. And shame is this emotion that keeps us in the tribe. Here's the left and right limit, stay in here. And if you don't, tribe gets angry and they kick you out. If you get kicked out, you feel shame and you fix yourself and you come back, or you don't, and so it's like, okay, this is, and you see this in animals and in packs, and humans are pack animals, we're herds, we're tribes. It's like what we do. So you put somebody on a small team, this is the tribe, and nobody else is tapping out, nobody else is raising their hand. And, and I guarantee you, nobody on the team is, if you're having issues, is going to be like, dude, you're a coward. No one's going to do that, but it doesn't matter what you think. Your body feels the pressure, and it feels this potential for shame. And like, I don't want to say anything, and so it's like, all right, now we know the playing field. We know what we're up against. And then now you're at like, key leader decisions where you're like, hey man, you're kind of worrying me. Okay. I'm not freaking out about you and being calm and whatever with them, but like, hey, I want you to want you to take a break, man. Sit down. We were talking earlier about Ukraine and the need to get back on the front, which is not an American experience for the last 20 years, pretty much. Like, oh, you're stressed out in combat, go to the rear, 3 hots in a cot, get back out there. Man, that's a stout issue. We're talking World War I shell shock stuff. I think that's another thing to consider, especially, right, we're getting to like prolonged field care stuff in a really intense remote environment where you just got the folks that you got with limited support and you're in some kind of crisis situation. I think that's a key leader task, man, is to be on alert for these things, and really being proactive in rest. I think the only things I learned in Ranger School were don't let your people starve and make sure your people sleep, or they will be disasters, and like, thanks Ranger School, sorry if that offends anybody, but I mean, those are key takeaways. Like, do not jack with people's sleep, make sure they're fed. So I think that goes to like the PFC environment. Dennis, I know you kind of run those lanes. I bet you watch people burn themselves down on those lanes, just going and going and going, never taking a break.
Never once. And this might be the right way to teach it or completely wrong way to teach it, but it seems like I have to make it almost ridiculous to where they finally catch on that I'm doing this to them on purpose so that they can see how ridiculous this is. But so you have a patient, and let's say there's 8 people in the room and they all want to do stuff. And so they'll just be getting in each other's way, and you'll see it quickly. So, I'll ask, the leader, like, hey, what are your goals, etc., priorities? And they'll rattle off some stuff. And then everybody else, it just continues going. Like, they're not even paying attention. And so I'll start just rattling off different procedures, like from the priority to like the quaternary. Like, it's like you wouldn't even be thinking about this for like 3 or 4 days. And like, guys will start. And so, as far as tasks go, they'll get, 48 hours worth of PFC tasks done in, the first 45 minutes, or they'll attempt to, until they finally figure out, like, this is dumb. Like, what are we doing? And then they'll start peeling people off. But sometimes, that's what it takes, versus just standing up. Leave. And doing it for them. I don't know if that's the right thing. I could be messing future medics up forever. I don't know.
Man, maybe there's an opportunity to bring that SABRE thing in there, where the PFC team leader who's running that thing. I don't know. Maybe that's just NCO stuff, where a crisis happens and you're just like looking at your people hopping and popping and doing what they do, and it's like, hey, you guys, we got to slow this down. We're going way too fast. We're burning things out. I do like movie examples a lot, but there's a scene in Apollo 13 when they're freaking out in Houston, and it's like, oh my God, we've got the problem up there, and I forgot the actor's name, but he has to do that. He's like, he co-regulates the entire room, and he goes, like, everybody stop. Like, they're just spinning, they're freaking out, and he's like, one at a time, where are we at? And he points at one person, and it's like, man, that guy was a good NCO.
All right, and we're back. Sorry about that. We had some life things happen, so we had to pause this for another day. But kind of rounding back out, we were talking about SABER and recognizing when somebody else they're spinning out, and those reptilian kind of brain is taking control, and how do we back them out of it? Same kind of thing. How do I recognize that's happening in myself, and how can I, stop the brakes? Like you mentioned that story about you and your son having a febrile seizure. Like, how on earth can you get yourself out of something like that?
Yeah.
Is it even possible?
Yeah. So, so here's my thoughts on this. All right. I might talk around this a little bit. I think one of the important points here, and this is my opinion based on just experience and what I've seen and whatnot. I think that your nervous system gets sensitized. I think I was joking around with you. Were joking around about how, like, team sergeants never get stressed out. You just get better and better, right? And it's just not. I mean, obviously that's not true. And we just get worse at handling stress over time if you're in this continual state of being stressed out. Now I'm talking a whole lot of the neurology stuff here as opposed to the psychology stuff. And everybody wants like techniques and whatever, but I think awareness and prevention is really where we got to go here, and being honest with yourself that your nervous system can only handle so much over time. So what do we see, back at group or wherever you're at is usually guys fighting to stay on a team as long as they can. It's like, okay, but you kind of get what you pay for. And if your nervous system gets really sensitive, and you see it in a lot of folks when they retire, they get anxiety about, it's like, yeah, well, retiring and completely changing how you do your life. It's a big ass change. It's a lot going on. It is anxiety provoking, but I hear over and over again that I feel like my anxiety is irrational. Like, I don't understand why I'm getting so anxious, and so if we look at our nervous system and say, all right, I've been through a lot of crap, and we start treating it like the other systems in our body that don't get better with time and with overuse. So I know your nervous system is not the same as your skeletal system. However, if you have a lot of wear and tear and you're sending, a lot of wear and tear in your skeletal system, and you've got little pockets of arthritis all over the place, the more jumps you have, the more rucks you've done, all that stuff is going to add up to a decreased performance, and in a very reasonable expectation that I'm just not going to be able to do what I used to. And I would invite you to just invite the listener just to consider that maybe your nervous system is that way as well. And I think that's not what people want to hear. And I think they want to hear like, well, it's all psychological and I can just power through everything. And I was talking with somebody who's a jump master and runs a whole jump program, and how he was kind of upset about how stressed out he was about running a jump. It's like, man, I've been doing this a long time. Why am I feeling like I have problems now? Do I have an anxiety disorder? And we started talking about how much he knows and how many accidents he's seen and how many bad things happen, Like, I got a bunch of static line jumps, but I never saw a toe jumper once, But you got a jump master from the deuce, and he's probably seen it. If they're jumping all the time in tons and tons of giant mass tack static lines, probably going to see something, And then next time you get up there to be the jump master, you got this thing in your mind of how things can go wrong, I mean, maybe there's a little bit of ignorance is bliss, but as you get more senior, you've got the experience that's kind of weighing into things, as well as I would say amount of electricity that's been flown through your nervous system, or how many hours in sympathetic nervous system activation have you logged, over time. It's probably a lot. And I think you and I maybe that was me and you joking around about how old we think we are in wear and tear years, and it's like, I joke around that I think I'm 65 in wear and tear years because I wake up with my hip hurting at night. It's really uncomfortable, and like I got to get out of bed and stretch my hip, But man, that hip has been through some ridiculous stuff. I think I can still remember back to Team Week and SFAS and remembering like, man, this is a lot. This is a lot of wear and tear in a week on my body. I'm sure it's that way for Hell Week or whatever is out there. Like, dude, how much stuff are we going to put this thing through? So if you look at your nervous system that way, okay, so to answer your question, All right, let me go to one more place before I go to directly answer your question. In terms of keeping an eye on yourself and monitoring, I don't think we're very good at being sensitive to what our nervous system's doing. So I think a major prevention measure is to work at some kind of practice or some kind of skill so that you know what your nervous system is doing. And I use this analogy of like a tachometer, and so if you imagine, we may have talked about this yesterday, I can't remember, but the parasympathetic being sort of like you're in rest and digest mode, the tach is at like 1,000 RPMs, and it's just kind of like sitting there buzzing, engine's at an idle, and when I'm asleep, the engine's cut off, but then I start the engine back up, I'm in rest and digest mode. And if you're revving that nervous system up in sympathetic activation over time, a lot, over and over again, maybe your new set point is not, the idle isn't back at 1,000, it's somewhere in the middle. And yeah, I am oversimplifying this quite a bit, but I think we need an image to wrap our head around this. Why is the stellate ganglion block a helpful thing for a lot of folks? I think that they have gotten to their new normal is, the RPMs are at like 3,000-4,000. And they're used to like jumping into the red in 5,000, 6,000, 7,000 RPMs, and then it's coming back to 3 or 4. And that's just life. It's not life. Life is at 1,000. And we're not made to run in sympathetic mode all the time. We're supposed to be rest and digest most of our lives, but that's not the life of a soft operator, And to be honest, it's also not the life of a stay-at-home mom these days. There's a lot of crap to get you stressed out, and so I think we've got maybe an unrealistic expectation for where our nervous system should be and what calm really feels like. But you were going to say something.
Yeah, continuing with the anatomy and physiology of things, skeletal system, the more stress you put on it in a reasonable period of time, the stronger it gets. It adapts. The nervous system adapts. And if you now live the life of adrenaline and aggression, your body is going to start adapting. How do I get to that razor's edge the fastest? Because that's better, right? Mentally, that's what you think is better. The calm down, nobody glorifies that part. It's like, wow, Justin, you fell asleep in that hammock restful, so freaking quick. I'm so jealous of you. Nobody ever says that. They're like, dude, I saw you rip a door off. That's freaking awesome. So that, we kind of adapt to that, and that is celebrated in the community. Being able to get to that place, in a quick period of time. I'm not at all qualified to say this, but your brain doesn't know the difference of what is good or bad. It just knows what is, and it will adapt physiologically and anatomically to facilitate what you want it to be. I don't know. Does that make any sense?
It really does. I think we were talking before about the different contexts for psych expertise, right? And our operational psychs and our performance psychs, they talk a lot about allostatic load, and I think that's, there's so much there. And I think a solid soft operator should really understand allostatic load, and that hey man, there are things that I'm doing to add to my overall stress load, that there's things I can do to take away from it. And man, our sleep, exercise, nutrition, almost paranoia that's a good thing in some sense. But there's also, doing high intensity training it's adding to allostatic load. So when you're stressed out, you should probably change the way you work out and start feeling good from your workouts versus I'm going to go kill it in the gym when I hear all the time, I'm super stressed out and I can't sleep, so I'm gonna go kill myself in the gym, and I'm just gonna crush it and then I'll sleep, and then they don't, and they're like, oh my God, what's going on here? And it's like, yeah, man, when your stress load can get that high, your body is stuck in sympathetic mode, and sympathetic is not time to sleep. It's time to be vigilant and observant and watch out for threat. I used to, when I retired, I started doing jujitsu in the evenings, and I can't. It's like, man, I'm going to be 58 here next week. I'm sorry, 48 here next week. This guy doesn't get I don't get my heart rate up after 5 p.m. Like, no way, or it's going to jack my sleep up. I think I just got sensitive to it, so no night jujitsu classes for me. And I, would even go in and be like, oh, I'll just like do technique and do some light rolls. Like, no, man, jujitsu is fighting. No fighting at 8 p.m. and expecting myself to calm down. I got more sensitive to caffeine. Like, I used to not. I could have the afternoon coffee. Now I can't. And I know, like, the old guys. I mean, as if I guess I'm kind of old. But we all like nod our heads, and then the younger guys are like, nah, it's not going to happen to me. I'll use pre-workout forever. Yeah. Like, man, good luck with that strategy. But on the on reaching a play, or let's talk allostatic load. I get to do like a public service announcement here. I'm just gonna put my sergeant major hat back on. All right, so the alcohol thing, I'm going to make this really simple. Blows my mind. TBI and alcohol. On one hand, guys are going to be like, oh my God, I've been exposed to so much blast. Like, fine. Whether it's concussion, blast, concussion, whatever, I don't really care. That is stress load on your body, right? And it may be affecting your brain. The last thing in the world that you should do is put alcohol in your body. I mean, it's just like, ask any neurosurgeon, neurologist, whatever, just like, hey, would it be a good idea if I had a mild TBI to put ethanol in my body? Like, no. And I actually pulled this up on my computer just to make sure I got the word right. But when ethanol breaks down, one of the components is acetaldehyde, and it's neurotoxic. It's like, and you get a headache when you're hungover because it builds up in your head, and your body's can't clear it fast enough. And so here we've got like an alcohol culture all through SOF, and we've got like paranoia about TBI, and I'm not going to say any more about it. I'm just going to tell your listeners, like, yeah, make sense out of that for me. Like, if you're breaching, do not drink, man. Like, that is no. And we'll be like, well, I'm gonna I'll take a day off or something like that, or I'll avoid bright lights, or I'll try to eat clean, and then I'm gonna pour ethanol in on top of it. Like, no, man, that's the worst idea. So if we can't care about TBI and have a drinking culture at the same time, like, it's not gonna work.
Our culture, I think, is what is the quick fix that gets me back to what I want, right? I want to get back to me, right? The operator, right? Whatever that looks like in your head, I want to get back to that. I can't sleep. Well, I know if I pour enough alcohol in my body, at some point you will, right? Yeah. It's just a matter of dose. After that point, I feel more relaxed when I drink. I'm anxious. I'll use this to fix that. Then in the morning, it's hard to get revved back up. Well, I'll use pre-workout because I'm gonna work out eventually. So I'll use pre-workout to ramp myself back up. It's the same as the old the Ambien and Provigil. Dex. Yeah. it's the same concept. It's just a different drug.
Yeah.
And like, your body didn't come with that. It has its own mechanisms to do that, and we don't facilitate what's the body wants to do. Like, the body doesn't want to live like that. It wants to live at idle, but we force it to do that because that's cool. And so the body adapts. Well, it adapts beyond its mechanisms to chill out again, or there's not enough time between awesomeness to get back to idle. And so we force it. And the more you force the body to do something it doesn't want to do, the faster it breaks down.
Yeah. We're talking a lot about, the job, right? And that can be very much where the operational psychs and sports psychs are focused. But the clinical psychs on the other side, in my world, we're worried about what happens when you get home, and holistically, how is your life going? So I don't know. I think there's like a shelf life on the operator. You should probably stop doing that at some point. Well, I think I mentioned to you that I don't do a lot of trauma work. I have colleagues that do a lot of trauma work. I do a lot of marriage counseling and family counseling. And man, I got to tell you, man, there's a lot of guys that when they come home is not safe. Home is where I get into fights with my wife. Home is where I get yelled at. Home is where I yell at my kids, or my kids hate me, or whatever. Dude, that will jack your sympathetic nervous system right up. And for some guys, work is where I rest. Work is where I need to feel calm, and home is not the, your nervous system doesn't interpret it as a safe place. So that's just, one more thing to consider with allostatic load. Is like, and it's hard for a leader to see what's going on in somebody's personal life. And so if somebody is having problems at home, we usually wait for somebody to say something, and if you do ask them like, hey, are you good? What are they going to say?
Yeah, of course I'm good.
Yeah, no, I'm good. I'm good. And so, I think it's necessary for especially senior people who've been there before to say, no, you're not, man. No, you're not. You can't be going through a divorce and be just fine right now. How are you sleeping? How are things going? And I need you to take a break over here, do something different, and be really proactive with it, because it's how we do it, man. How you doing, man? You good? Yeah, I'm good. No, you're not. We'll just say that we are. It's our culture, man. You don't say, yeah, you know what? I'm actually not well. Thank you for asking. No one ever says that.
No. And this kind of leads into my next question. So, dealing with failure. Failure could be in the job. As a medic, somebody died. Like, I did what I knew to do, and they died. They had an injury that I couldn't fix, and they died. And I imagine the same thing as, I thought I had a good marriage. I thought I had a good family, and it's fallen apart around me. I have failed, and I don't know the answer to all those things, whether that be work-related or home life-related. How do you even begin? Like, one, you have to overcome, like, you have not done well, right? Whether that be your fault or not your fault. Like, how do you even begin to get somebody over this hurdle? Yeah,
man, that's a doozy.
It is.
It is. As you were talking, what immediately come up in my mind, a lot of times us medics will kind of like throw our doctors and PAs under the bus, just be like, whatever, you don't know, you're not a line guy. But they live in a world of medical mistakes, and like every one of that I've ever met has made some pretty stout errors. And if they're willing to be vulnerable, we'll be like, hey man, yep, we make mistakes. Here's what happened to me. It's rough, and So I guess one sort of, I guess, piece of advice is like, that's really a place to lean on these folks, right? And maybe they haven't been through the exact thing that you've been through, but your medical officers and whatnot live in this culture of like, what do they call, like, grand rounds? Like, this happened last week at the hospital. It was a bad outcome. We got to do better, you guys. Like, man, they stare, a lot of them stare shame right in the face. Like, that's my fault. I made a bad call and the person died. Here's what happened. Here's what I think I could have done better. And man, I think it could be a toxic culture at times, but it could also be a really helpful culture where people are owning stuff. And just look at that as sort of an analog to, well, it's not an analog. It's sort of the opposite of what we have, which is like, don't say anything. Keep that shit inside yourself. Don't admit it. Don't admit weakness, And I think that's a necessity. I mean, I think those grand rounds type things are a necessity in the hospital. It's like, yeah, we got to prevent things from happening again and get better at what we do. But it's also, that's also a support mechanism. Like, we're all in this together. And if you can be humble about what happened, it helps me to be humble about what happened to me, and like, I think that could be really helpful. One more comment on that. And so I'm not saying like you guys have grand rounds in the team room or the company or something like that, but I think it's something to think about. Who's your medical tribe? That you can have conversations with medically. And it doesn't have to be, maybe it doesn't have to be your chain of command, but you got folks that you can talk to. A good friend of mine, Dave Calloway, is ER doc in Charlotte, and he's sort of a big deal at Charlotte Medical Center. But he was telling me a story about how they had a Christmas Day fire where a whole bunch of folks got burned pretty bad, and he was talking about how it really kind of hit everybody hard. And I'm thinking, well, it's the emergency room, it's the ED, man. Bad crap is happening all day, every day. And what I got from him was that he could see it in people. Like, okay, yeah, we deal with the worst of the worst every day, but this one was really bad, and being able to kind of recognize it and go like, hey, let's go to the break room. Everybody go to the break room. Let's just talk about this for a minute. And I'm telling you, just acknowledging what happened, just acknowledging that, hey, man, that was a bad one, and making space for that is really helpful, And a lot of times we can overdo it. Like, we got to have a critical incident stress debriefing team come in from wherever, and like, probably not, man. The best stress debriefings I had, man, were team sergeant, troop sergeant major saying, hey, that was a doozy. Let's like bring it in here, and and we just talk about it for a little bit, and like, that's that, and it was actually really helpful, and we weren't trying to do anything or bringing medical folks in to try to fix it, So in saying that, I want to empower the leaders out there to trust your gut. And when especially if your medic had a bad day, check in with them. Like, I think that's just a powerful thing to do. Acknowledging, like, man, that was a doozy, and at least have a dialogue about it. In your question about keeping tabs on yourself, man, you can go in a lot of different directions with this, So I'm going to weave this back into the previous question about stress load and noticing what's going on in our nervous system and whatnot. I think that you have to have a daily practice of calm. And I've struggled with all sorts of different meditation practices over the years. And I know as soon as I say the word meditation, half your listeners like shut off and they're like, oh God, here's something. And like, oh yeah, I downloaded Headspace. I never use it, but I got it on my phone if I need it. And the point, so a couple of points here. One, we often overdo what the helpful thing is going to be, and it's like, a meditation practice looks like me sitting in the lotus position in my specially designed meditation room in my house, and and I do that 20 minutes a day and I shut out the world. And it's like, that's not it, man. There's no way that's sustainable. That's monk stuff, and that's black belt stuff, and it's not who we are, but if you don't have a practice where you're deliberately sitting in the calm, you're probably going to lose focus or lose sight of what calm feels like. And next thing you know, you're that dude whose tachometer is operating at 2, 3, 4, 5,000 RPMs, and you don't even realize it. And then you get a stellate ganglion block that drops you down, and you're like, oh my God, man, that's what calm feels like. And that's what everybody says. And they're like, wow, and for a lot of folks, the shot will wear off in a day or two, and it just creeps right back up. But at least they got to know, like, oh God, that's what a calm nervous system feels like. So my new method of meditation that I'm teaching is called coffee and tea. And if you sit in the morning, get up, don't look at your phone, get your cup of coffee and sit there for 10 minutes and drink a cup of coffee. Don't do anything. Just enjoy your coffee. And it's sort of like a 5 senses meditation if you want to be all goofy about it. Like I know the way my wife enjoys her coffee and she's like really enjoying it. Do something like that. Just sit there and drink your coffee for 10 minutes and notice that you just got out of bed and you're calm. And if you want to be, like biofeedback guy and you want to look at your heart rate and all this, fine, whatever. But this is calm time. And I do that every single day. And all I'm doing is having my morning coffee. But what I'm not doing is checking out the news about, oh my God, man, the other morning, opened my phone to like the Charlie Kirk incident. And you're like, holy dude, my heart rate, my blood pressure jumped. You're like, oh my God, man, that is not a good way to start your day. And start it with like the saddest thing that happened, like let's start the day with that, or the most tragic thing that happened. So I think people have a natural meditation in the morning when they get up and just have a cup of coffee, and we're killing it with our phone, with the news, or just checking your messages or whatever. And I would, all of the different meditation styles all over the world, transcendental meditation, Christian contemplative meditation, Zen, all these meditation styles all seem to come up with 20 minutes twice a day. And thought that's really interesting. That's also a tall order if you got a family and kids and a job and all that stuff. But drinking coffee for 10 minutes in the morning, doing nothing, but just sitting there calm, that's a pretty good start, And then in the evening, make your cup of decaf tea or whatever and just sit down and drink it. A lot of times you won't be very calm, but you're noticing, okay, I'm trying to get calm by just sitting here and drinking my tea, but you're getting this contrast about the morning and the evening. Then you go to sleep and you wake up the next day and you have your cup of coffee and you start getting really sensitive to what calm feels like. Then you're starting to notice when you're starting to get ramped up and you're getting really sensitive to that. And you're like, dang, all that happened was I got a piece of bad news. I got an email and man, I'm no longer calm. And you're getting really good at noticing this so that when you're way too elevated. And we do this in couples counseling all the time. Like you really can't have a productive dialogue with your spouse if you're all pissed off and angry and your limbic brain is activated and your heart rate's up and the blood pressure. It's like it's not going to happen. And so one of the interventions is getting really good at recognizing each other's physiology and being like, oh man, your face is red, my face is red, like our voices, we're shouting, we can't do this. Like there's no way that this is going to be productive. We got to stop. And then we'll come back when we're calm and have a conversation. Well, I think in order to know when you're calm, you got to be really good at know what calm feels like, So that's sort of my recommendation for the last question. And in this one, in terms of monitoring yourself so that when you're getting really out of whack, and I don't know if that tachometer image is useful for people, but thinking about where your needle is at, I would add to that, your emotional system, like how revved up you're getting there, it's kind of a separate system from your thought system. So you can have like a racing mind, that's just thinking all these different things. And it's not like it's this big emotional event, but like, I got a lot of crap on my mind, so that's almost like another tachometer on your imaginary dashboard. Like, where's my thoughts at right now? And if it's, I got to do this thing, and I forgot to do this, and I got to pick up the kids, and I got to go here. It's a lot, and we should be really aware of what's happening there. A lot of people want an intervention there. How do I quiet my mind? And like, can I like say something to myself, or can I do a thing that quiets it? And it's like, you gotta let it do its thing and let the RPMs fall. So even if you're sitting there with your cup of coffee or your cup of tea and your mind's racing, just sit there with it and give it time. And that 20 minutes thing, if you go 20 minutes, I tell people all the time, like, man, it took me 19 minutes to get calm. And man, I got a minute where I felt like, wow, that was really peaceful. Thanks for that, And like, that's what we're doing. We're getting really good at allowing our thoughts to start to ramp down, and our emotions to ramp down. So anyway, that's my imagery there. I think I partially answered your question.
Yeah, I think so. Yeah, I mean, it's definitely about the combat stress part. Yeah.
Yeah. So we were talking about imposter syndrome, which is kind of psychobabble. It's like, oh, I've got imposter syndrome. But I think a lot of people recognize this. And I think I have just a quick message here. There's a lot, because there was so much combat for so long. There's a lot of really talented commandos that don't have much or any combat time at all. And so they invalidate their stress problems. And they're like, well, I didn't go through what you did. And, I think you and I both, in separate, deployments, had some really good times, man. Like, it was not all bad. I wasn't like in a foxhole stressed out for 4 months at a time, and guys look at that because they don't have it, and they go, oh my God, that must have been so crazy. And they discount how stressful training is. And we were talking earlier about how stressful SEER school is. Like, they made you believe it was real, It gets crazy, dude. It stresses people out. Jumping out of airplanes, static line, or I think static line's probably worse than free fall, man. It's like, we are way too low. We should jump from higher. Like, it's a really stressful thing to put your system through. In addition to all the social stress, I look back at the stress of the Star Land Nav course. Like, all right, man, here we go. Like, I remember that day being like, good God, depending on me finding chem lights in the dark this evening for a whole day of land nav, I might PCS. It like might change my family situation. That is an incredible amount of stress for people to have. So if guys feel like an imposter because they didn't go to war or something like that, I don't know. I got nothing for you. Perpetual warfare is a really bad idea for people in general. Like, it's not a good thing, and I think guys want that. And I would want your listeners to lean into the stress that they've had and really appreciate it and go like, okay, I have been through a lot of stuff. Like, I've been through a ton of stuff. And sometimes I think the training's worse than the combat in some cases, where, you're on the range and there's like, the deal, man. Next thing you know, there's somebody with a pro timer and a metal clipboard, and your shooting just falls apart on the range. And it's like, that's incredible amounts of stress. And that's that whole stress curve, and going from like, the yellow to orange to red, and then falling off into the black, where you're non-functional. But it's like, I think if you've been through a lot of that adds up, and you get stressed out, so that's just my little take on imposter syndrome.
So, say you're talking to that guy who, is very dismissive of whatever it is that they have done.
Yeah.
And I can imagine it happens at all levels, like from the lowest to the highest, where you are not matching your mental image of what that person is.
Yeah.
Which could be reality or not reality at all.
Yeah.
Like, I guess, how does one get beyond that?
Yeah. That's a complex, I think that's a complex issue. And I got a little bit more time. So my next person's running late. So, expectations, right? Expectation management. People are vastly different. We do all this personality testing throughout our different programs, right? And one of those is the big five. It's the NEO-PIR. And the results are kind of invalid because everybody wants a job. So they do their NEO and they're like, you probably want a green beret that looks like this. So you fill that thing out. And I'm not saying it's all invalid, but like, come on, man. The results aren't just this person being a total open book, right? So for example, I looked at old NEO scores that I had in a selection program and I retook it as a SAR major who just didn't care anymore. And I'm like, this is how I am. And man, neuroticism is one of those, like proneness to negative emotion is one of those scales. And when I wanted that job back in 2004, I made myself like very neuroticism. Dude, nothing could be further from the truth. I get anxious and upset and stressed about stuff quicker than most people do. It's just how it's temperament. It's just like how I am. When I was a kid, in my conscientiousness scores are really high. That means when I was a kid, I remember stressing out about spelling tests. I remember stressing out about all kinds of stuff. Like I can't sleep because I got a math test tomorrow when I was in like 7th grade. Meanwhile, there's other kids who like, they just don't care. And there's a broad range there in just a couple different personality lanes. So I wonder, with your question, if we look at certain people and don't appreciate that they're an entirely unique temperament and makeup and social situation and history and epigenetic profile and all that stuff, and we're like, I ought to be like that guy. Like, well, maybe that's not you. And maybe the thing to do is to kind of lean into your own self-knowledge. Like, maybe I am just a lot different. I process stress differently, and I find myself getting anxious when everyone else is yawning, and like I think I was pretty freaked out on every jump I ever did. I never got like super comfortable. And then I remember like looking across from me and there's a dude yawning. And I'm like, I wish I could be like that guy. He's like cool as a cucumber, but that's just not me. And man, if somebody told me, look at the ability we have to kind of shame each other too. Be like, you ought to be like that. And you're not, and then next thing you know, like, oh, I'm a loser. I should be better at this.
That same person that they're like, you need to be like that guy. How much do you actually know about that guy? Like you see what he is at work. He's physically fit. He shoots like a laser beam. He's fast. He's smart. He's a great leader. Like you see all those things, but there's like probably a novel of things that you have no idea about. Like what's his home life like? His wife hates him, his children hate him, his family hates him. He actually has no friends. They're all work acquaintances. Do you really want a team full of those guys?
It's like you've been sitting in my office listening, but I being in the military for 23 years, you think and it's like you don't, man. I did a pretty long military career and I retired, and I was around all these people all the time and deployments and all these things, And man, when you get to sit down with somebody one-on-one and find out what's really going on in their life and they open up to you about it, dude, it's really humbling when you realize how many people are dealing with all kinds of different stuff, and how, having an autistic kid will burn you down, man. It's a lot, it's a lot of stress load on people. And if you never asked, you don't know what they got going on, and I mean, just back to the alcohol thing again, I won't harp on it too much, but there's a vast difference in what you can handle and what your history was. And man, we have slam dunk research on epigenetics in alcohol, and if this is a culture where everybody's got a drink to fit in, that's a horrible idea, because there are certainly people in the team room who, if you looked at their family tree, should not be drinking. And the alcohol, as soon as they touched it, something happened in their brain and they're hooked, versus ones who build a career of drinking over time, and I don't know what to tell you, I don't know what to tell our community. It's a thing, got all kinds of, alcohol issues in there, and I get to see the other side, and damn, yeah, I don't know what to do about it,
I guess I'm going to pretend to be you. From when you entered the military to whatever year you were at your peak, in your own mind, how long was that?
I don't know. Staff sergeant popped into my mind. Yeah.
Okay. That took you 6?
Yeah.
About 6 years? Okay.
Yeah.
That took a lot of work. That took a lot of effort. It took time to get to that person.
Yeah.
Is there out there, and you're at the top levels and now you're on the medical side, is there a thing that I can just inject in somebody that will make them span that 6-year distance faster, maybe in 1 or a couple of months, maybe, that I can just give to somebody and now they're instantly this person?
Yeah, I think there's a movie about that.
Yeah, there's a movie about it, because that thing doesn't actually exist.
Yeah.
We always want the quick fix. The quick fix is always the easiest, but yet in life, that generally never is the right answer. It always fails. Even in the movies, the quick fix fails. We have a habit of looking for the easy way out, and it's not just our community. I think it's just humans, because quick and easy is always better than the hard right. Embrace the hard right. That's going to be better for you long term, I think, versus seeking the alcohol or the drugs or what makes you feel good right now. That should tell you something about it. If it makes you instantly feel good, it took you work to get all the good things in your life. It's also going to take work to remove, to come back to center. I don't know if that makes any sense.
It really does. Man, I want to give this plug about retirement. I didn't do well retiring, and I had all the resources available to me. Part of the problem was I had an expectation that I would cruise through it, and it really affected me. I'm I'm done with the Army, man. I'm so done with it. I can't wait to be done. But all these little things stacked up, and if you look at the term dopamine hit isn't exactly correct. However, it's kind of useful to wrap your head around what's going on. But when you interrupt all the little dopamine hits that you get throughout the day, I'm logging on to special important email systems. I wear a badge around my neck to get access to a thing. I've got a clearance. All these things that happen throughout your day that sort of build a sense of normalcy. when those get interrupted, it feels really unsettling. Your nervous system doesn't like it at all. So retiring can be a pretty difficult process for a lot of folks. One of my favorite clinicians out here, Doc Bacon, he was an Army psychiatrist for like 30 years, man. He's seen a whole bunch of stuff. And I was chatting with him, and he said, I bet Tom Brady had a really hard time retiring. Like, his world looked like amazing, just like high level amazing for a really long time. And then boom, it changes, and he's like, to your point about 6 years, he's like, hey, your neural pathways, when electricity is flowing down that wiring harness in that way for that long, that's normal to you. And you change your life, you go do something new. And that could be even just moving from a line guy to an ops guy. Because how many guys go to an ops position and it freaking eats their lunch, man? And they're like, I have TBI, and because it's just like a completely new environment. And they're like, I can't function. What's wrong with me? It's a massive change, And he's like, hey, think about spinal cord injury, because we're talking neurologic stuff. We're talking about wiring pathways and neurotransmitter levels and all that stuff. When somebody bumps their spinal cord and it takes them a while to learn to walk again, it takes a lot of time. And he's like, we're talking about new neural pathways that have to be built. Like, hey, I know that was enjoyable, or that felt normal here, but this is, and it really is like a new normal, but it's going to take time, and it's going to feel very shitty. It just is, because it's a big old change, and if you go from Army to like Army contractor job, you may be delaying the inevitable, so that when you retire with your second GS retirement or something, watch out, man, because you've got so much time built up of this is what normal looks like, and it's just like accepting, hey, take me a couple of years to really normalize, and it's going to be a bumpy ride, and there's a whole bunch of helpful stuff in there, that can, such as a, daily calming meditation practice, there's, yeah.
Yeah. You got to start with something, right?
Yeah, man. Hey, I got to give a plug to Soft Network. So, I'm wearing my Soft Network t-shirt here. So Soft Network is just a clinician Rolodex, and this nonprofit is just a whole, if you go to softnetwork.org, it's a Rolodex of clinicians who are vetted, and it's I'm one of the board members there, and there's a process for vetting folks. But the idea is just to give people one more step, or remove one more step from finding somebody to talk to. So it's organized by state. So wherever you're at, you can usually find at least one person in that state. A lot of folks are licensed in multiple states and whatnot. When we talk about suicide prevention and all that stuff, really going upstream, and saying, it's obvious, like early intervention, and hotlines are fine, but I think hotlines it's late. It's very late, and we should have gone upstream way earlier. And man, there's obstacles to going to talk to somebody, especially if you're like, I don't know if my TRICARE thing is current or correct or up to date or whatever. And like, well, I don't want to go through the insurance crap and I got to get a referral. Well, I think SF Trust is doing a freaking bang up job, man. It is like streamlined. If you need help, you download your code, give it to a clinician, done. Like and if you're having like a marital crisis, sometimes, man, like finding a marriage counselor, sifting through the 1 million pages of Psychology Today to find somebody, they all look amazing. Our hope at Soft Network is that we narrow a bit to where somebody at least speaks military, what was in the military, was a military spouse, something like that. So you at least have a better start point when you're doing counseling. So anyway, that's my plug for that. It's not like a money-making venture. It's just trying to support the community better with connecting with therapists.
That's awesome. That's awesome. How long have you been doing that?
Man, it's gosh, I think Soft Network's like a 3-year thing, you know? Yeah, I mean, it's cool when you look at it, you see all these different folks, different backgrounds. You know, you've got, Navy SEAL turned counselor, SEAL spouse, bunch of Green Berets, counselors in there. And they have what's called the pipeline, where if you want to be like me and you want to get in the mental health field, whether that's licensed professional counselor, clinical mental health, clinical social work, PhD psych, PsyD, whatever, Soft Network can link you up with a mentor so that you can try to discern what the heck it is that you want to do and get put in the right direction. And somebody can kind of follow you through your journey. You know, like I got a controller that I'm working with. Guy's done being a controller. I got linked up with him, and so he's doing school, and we're kind of doing check-ins along the way. You know, so yeah, it's good stuff, man.
Yeah, no, that's awesome. Well, I'm glad that everything seems to be working out for you and your transition out.
Yeah, man, thanks. Hey, I know we got to split here in a second. Dennis, I want to thank you for what you're doing, man. Podcast one, keeping that thing going, but man, that PFC thing is, it's going to be like this sacred knowledge, because you can see the military do that cycle of like spinning up and getting really good at stuff, and then it kind of drops back down. I think there's a name for that.
Yeah. The Walker dip.
Oh, there it is. Okay. Yeah, that thing. You know, and it's like, man, you're going to be the dude who's
that's so sad.
Yeah, well, I know, man. Dude, I remember when they were all civilian surgeons in Baghdad, because way back, because the Army guys were not doing trauma, and then the Army guys became like the trauma gurus, and then the civilians got moved out, and then if there isn't a whole bunch of war to do, you know, that probably drops back off, man. So thanks for keeping prolonged field care a thing.
Thank you for, I guess, bowing out forcefully, because I was 100% going to let you continue doing it. But yeah, I remember, X number of years ago, listening, to a brand new podcast, Prolonged Field Care, and it just rung a bell.
Yeah, and I pirated like that Black Keys intro. I didn't think anyone would listen to it anyway, and so by changing that, you probably saved everybody a big lawsuit, you know. So, do we have rights to this song? No, we do not.
Yeah, I had to get through a couple of hoops to get the rights to this Africa song, but nailed it.
Yeah. All right, man. Yeah, good to chat with you, Dennis.
Awesome. All right, have a good one. That's it for today's podcast. Make sure to go to our website, www.prolongedfieldcare.org. Check out our free downloads and a ton of other helpful information. Grab a bag of our fresh roasted PFC coffee, links in the description below, and stay on the bleeding edge of combat and austere medicine. This is Dennis for the PFC podcast, out.